Hello, the time is now 12:30 p.m. Eastern, the official start time for today's broadcast. The topic today is screening for alcohol misuse in older adults. And now, without further ado, I'd like to turn things over to your host, Stacy Hull, Behavioral Health Lead with Alliant Quality. Stacy, the floor is yours.
Thank you. Good afternoon, everyone. I would like to thank you for participating in Alliant Quality's Learning in Action Network event today and for your continued commitment to integrate behavioral health into your practices. Before we get started, I want to remind you that in addition to the free monthly Quickenars, Alliant is also available to provide free technical assistance to you and your staff. We can assist with things such as process flow, resource coordination, training, and evidence-based tools. I invite you to take advantage of these services and to reach out to us if you have any questions or concerns. Now, it is my pleasure to introduce our speaker, Dr. Paula Hartman-Stein. With more than 30 years of experience as a healthcare educator and clinical psychologist specializing in aging issues, Dr. Paula Hartman-Stein currently works as an independent consultant and is the Medicare correspondent for the National Psychologist newspaper. Since 2007, Dr. Stein has served on technical expert panels for the Physician Quality Reporting System. Her current academic appointments include Associate Professor of Psychiatry at Northeast Ohio Medical University, Senior Fellow at the Institute for Lifespan Development and Gerontology at the University of Akron, and adjunct faculty in the Integrated Primary Care Certificate Program at the University of Massachusetts Medical School. And now, I would like to turn it over to Dr. Hartman-Stein.
Okay, well, thank you very much, Stacy, for your kind introduction, and thank you to Alliant for giving me an opportunity to teach about this important topic. We have a variety of objectives to achieve today, and hopefully we'll get through all of them. We'll be identifying what codes, CPT codes, that providers can use for the alcohol screening and brief counseling through the Medicare system. We'll look at the reasons to screen for alcohol misuse and look at the factors that contribute to what is called risky or hazardous drinking in late life. We'll talk about the common medical conditions that are made worse by this risky drinking and look at a validated screening tool called the AUDIT, Alcohol Use Disorders Identification Test, and I will talk about strategies to ensure valid screening. Okay, so these are your CPT codes that you can use. The first one, G0442, is one that it's for 15 minutes. It can be done on an annual basis, and this is made available through the Affordable Care Act, the current law of the land, and Medicare beneficiaries are eligible for screening of several behavioral health issues, one of which is including alcohol misuse. So the other code you can see, G0443, is brief face-to-face counseling for people who screen positively. That means that positivism is not a good thing. Obviously, that means that there's some evidence through the screen that the person is misusing alcohol. And so you can do the frequency with 4 times a year for the counseling, and for both services, and I think this is interesting and a good benefit, the co-payment, co-insurance, and deductible are waived. Okay, let's look at, we have a polling question now. We would like some audience participation, and you, how often do you screen for alcohol use in your primary care practice? A, never. B, occasionally, about a quarter of the time. C, sometimes, half of the time. D, usually, 75%. Or E, every single time.
And Dr. Hartman-Stein, it looks like we've got a little variation between the sometimes 2 responses, usually 1 response, every time 2 response.
Okay, interesting. Well, we'll give you some national statistics that 13% of primary care physicians report that they screen on a regular basis for alcohol misuse using standardized screening tools. So from our audience participation, we hope that you'll be motivated after you hear this to screen more often than you currently do. Well, why should you screen? What's the purpose of all of this? Well, alcohol misuse or abuse among older people are often hidden and overlooked or not diagnosed properly. And when I was preparing for this webinar, I learned a lot of things, as we do when we're speakers and we read a lot of material, that the misuse is more harmful in late life. Misuse, that's slightly different. It is different than alcohol abuse disorders, but misuse can cause problems. The impact of injuries is more severe. There's medication interactions, it's greater, and general physical effects are debilitating. And I want to add some information I don't have on the slide, but just some examples. Aspirin or arthritis medications and alcohol, mixing those two, increases the risk of bleeding in the stomach. Acetaminophen and alcohol increases the chance of liver damage. And during cold season or allergy season, which can be all year round, cold and allergy medications we know cause drowsiness. Well, you mix that with the alcohol, there's more drowsiness, more sleepiness, which leads to what? Poor coordination. It also can lead to breathing problems, rapid heart rate, and an area that I've had a lot of people coming to me for evaluations, people who are reporting memory problems with advancing age. Now, not to mention the medication issues, but of course, alcohol use increases the risk of driving accidents. The risk of crashes without alcohol goes up after the age of 55. Well, alcohol adds to this risk. And blood alcohol concentration levels, even below that legal limit, can still impair driving skills, and people are not even aware that their driving may be affected. And another area, of course, with older people are the problem with falls. Alcohol can lead to balance problems. We all know that balance becomes more difficult with advancing age, and of course, falls result in what? Hip, arm fractures. Our bones get thinner as we get older, and the rate of hip fractures definitely increases. One other thing that I did not mention is that alcohol misuse and abuse can strain relationships with family members, with spouses, with adult children. Adult children may not want to bring the grandkids over. And of course, at its extreme, alcohol abuse can lead to domestic violence. Well, how big a problem is this? What's the big deal? Well, among older adults, alcohol is the most abused substance. We hear a lot today about opioids, and of course that is a growing problem, but alcohol is clearly still the most abused substance. And in various surveys, 65% of older adults acknowledge that they drink, they use alcohol. That's not bad if it's light or moderate drinking, but we'll talk about that. But a relatively small percentage of people over 60 in the community acknowledge that they are abusing alcohol. But then when you go to medical settings, then the percentage, of course, increases. So 10 to 15% of men who are seen in various medical settings acknowledge that they are abusing alcohol. And this other category of risky drinking, it goes up, as you see, 17% of men, and about 11% of women over 50 acknowledge that. So, but in primary care practice offices and emergency departments, well, there we have alcohol and other substance use diagnoses tenfold more frequently than in the community. So how much is too much? All right, well, our National Institute on Alcohol Abuse and Alcoholism, their guidelines define it this way, that 7 drinks per week are considered moderate drinking. That's per week, not per day. And using that guideline, it's the same for men and women, but Other studies suggest that for women over 65, no more than 4 drinks per week is recommended. Now, in this category called risky drinking, that's per occasion. So 5 or more drinks for the males and 4 or more for women per occasion puts you in the category of risky drinking. So what's a drink? Now, here's some good pictures of drinks that make them look quite tantalizing. But what's a drink? Well, a drink's a drink's a drink, right? 1 bottle of beer, 1 glass of wine, that is a 5-ounce glass, or, and I've seen people say, well, here's a glass, and it's a huge, huge glass, so we're talking 5 ounces here, or 1.5-ounce shot of spirits, which is a 40% alcohol. So, but one mixed drink can contain from 1 to 3 or more standard drinks. Some people put a lot of alcohol in those martinis, so it may be more than that 1.5 ounce. We have another polling question for you. Okay, audience. So what barrier is your biggest challenge in conducting these screenings for alcohol use? Time? Is it A, time? B, is it uncomfortable asking such questions? 3, it's just not a part of your regular assessment. D, is it because of billing issues and uncertainty? E, lack of referral resources is needed. That is, are we opening a can of worms that we can't do anything about? F, none, you screen, or G, some other reason.
And those results are calculating. It looks like the top answer was 3 people responded, none, I screen. We have a few other results. And uncomfortable asking the questions, not part of an assessment, and lack of referral.
Okay. Well, let me tell you some of the, again, from national survey perspectives. As I mentioned earlier, about 13% of the primary care practitioners screen regularly. Well, why is it so low? Well, one of the reasons that comes up in various surveys are some ageist assumptions. As one physician once said to me, don't waste your, he actually said it this way, don't waste your wind on getting that patient to change, assuming that because the person was in his mid-70s, nothing would change his habits. There are other ageist assumptions, such as, well, drinking is the only thing that makes Grandpa happy, so why take that away? Well, that's kind of a pathetic idea. If that's the only thing that makes him happy, there may be some other things that you might want to introduce to Grandpa. Another ageist assumption might be, well, what difference does it make? Grandma's not going to be around much longer, so why do we need to do this? And yet another relatively common ageist assumption is that it's simply a waste of resources. Now, other reasons can be just failure to recognize the symptoms and subtle signs of alcohol misuse. The alcohol abuser might have it almost, quote, written on his forehead, but the misuse is much more subtle, and that's why we're trying to get, the Medicare system, trying to get primary care practitioners to be more aware of this misuse concept. And I think that as one of, one of the persons on our line acknowledged today, and believe me, you are not alone, there is discomfort with addressing this topic with older adults, and we'll talk about that. Okay, what are the types of alcohol problems that you see in this population? Well, it seems to split into 2. There are those who have been big alcohol users before the age of 60, or those who it's more of a late life problem, a new problem. Now, the earlier onset alcohol use disorder patients make up about 2/3 of the alcohol misusing drinkers in this population. They're usually men. They have more alcohol-related medical problems as well as psychiatric comorbid conditions such as depression or other psychiatric conditions. Now, the later onset people, the people who just have started it in later ages, typically have a mild, this is good, they have a milder clinical picture, usually fewer medical issues. They tend to be, to have more money, more are women, and usually it starts after some stressor in life. So let's look at these definitions about alcohol misuse. That means consuming it in an amount that increases the chances of health consequences, such as those falls I mentioned, or those interpersonal problems and various medical consequences as a result. The harmful use, that results in pretty significant consequences to both physical and mental health. Now we have the alcohol dependence issue, and that's a little different because it's a cluster of behavioral, cognitive thinking, and physiological phenomena that develop after repeated alcohol use. And there you can see the definition about the strong desire to drink, impaired control over its use, persistent drinking despite being told about the harm, and increased alcohol tolerance and physical withdrawal symptoms. So, but in the screening that we're trying to encourage practitioners to engage in, this is really looking more at the misuse than the dependence. So here are some of the red flags about misuse. Solitary, secretive drinking, the ritual of drinking before, with, or after dinner, some symptoms that we find with depression, loss of interest in hobbies, drinking despite the fact that the warning labels on the meds say this is not a good idea. Also, people who frequently use the anti-anxiety meds may also be closet drinkers. Empty liquor and beer bottles. Now, it's family that will know that. You won't know that in your outpatient offices. But if you're working in an assisted living facility, you might mention that, and I'm going to mention a little story about that in a minute. People who exhibit hostility, particularly males, may also, that's considered a red flag. You might definitely ask those people about their alcohol use. And in my view, people who are coming in for complaints of memory loss or confusion, you definitely should do the screen, and also the frequent falls. People sometimes, practitioners don't think about the alcohol as a potential etiological factor for that. Okay, here's a little quiz I just put together that, let's see, we won't ask your answers, but do it for yourself. Okay, which group do you think has the highest rate of alcohol dependence in the United States? Do you think it's widowers, men who've lost their wives who are over the age of 75, or widowers between the ages of 65 to 74? Well, the answer to this question surprised me. The answer is A, widowers over age 75. I thought it would be the younger, more baby boomer group, but it's not. So that's interesting. And this other one, what percent of psychiatric admissions of older adults are due to alcohol or drug problems? Is it 5%, 10%, 20%? I was surprised at this one too when I studied this. The answer is C, 20%. So I thought it would be other issues, but so it's a significant reason for psychiatric admits. And the third question, older adults are hospitalized as often for alcohol-related problems as for heart attacks, A, B, suicide attempts, C, cancer treatment. I thought the answer before I studied this might be B, suicide attempts. It's not. The answer is A, heart attacks. How about that? So we know heart attacks happen more frequently with older age. Well, people are hospitalized also as frequently for alcohol use problems. So here might be a guy who volunteers in a school, but he might also be a risky alcohol consumer. So you can't tell by appearances, that's for sure. And this lady may be a harmful alcohol user. She looks like a patient I saw about 10 years ago in an assisted living facility who had depression and frequent falls. And when I was asked to go in to evaluate her in her assisted living apartment, what did she have? Along the walls were bottles of very expensive alcohol, all in display. And when I asked about that, she said, "Oh, my dear, would you like to have a drink right now with me?" So, you know, this is like addressing the elephant in the room. The staff clearly could see this, as I could, and her falls and her depression appeared to be clearly related to her alcohol use. So what are the factors in becoming an alcohol user in late life? Well, it could be, in that one group that is just hasn't been an alcohol misuser or abuser in earlier days. They may be responding now to their loneliness, their grieving, or lack of meaning or purpose in their life. Or it may be a lifelong outlet to dull emotional pain. Or what I see in a lot of the assisted living and retirement communities, it's a sociocultural habit or ritual, having happy hours. Which is, you can do that, but it's the amount that people drink that's the issue. Or it may be a response to chronic illness, disability. And this is clearly true in my experience that cognitively impaired older people may drink more than they even realize or remember. Now, we've all heard that there are benefits. Yes, that is true, but there's some caveats there, okay? So have drinking in a, light to moderate, and light to moderate drinking means with men 1 to 2 a day, women 1/2 of a drink or 1 drink a day. Statistically speaking, that is correlated with less likelihood of developing or dying of heart disease, ischemic stroke, dying from heart disease. In some studies it suggested a reduced risk of diabetes. Okay, but it's not clear if consuming the red wine or other alcoholic beverages account for better health. It may be that these people are healthier to begin with, okay? So no one is going to suggest that you've never been a drinker before, so why don't you start boozing it up so that you increase your health. No one would ever say that because that is bogus. So this is my summary slide. You might want to look at it later, but all these things we talked about, or some of these things, the memory loss, the falls, disinhibited behavior, cancer, interesting, cancer of the throat and mouth. With women, there is a slight increased risk of breast cancer with regular alcohol use, and that doesn't even mean a lot of use, but any inflammation of the stomach, impairments in blood clotting time, pancreas problems, sexual performance problems, and of course the medication issue that I alluded to. Okay, so here's the audit. Interesting, it was first developed in the 1980s. It is brief, rapid. There's 10 questions. It's easy to score. We gave you a copy of it, and there's a link to it for you to download it. And so it's 10 questions. So you can look at this, and you just answer. You can do it 2 ways. You can do it in a questionnaire, or you can do it as part of your regular history. And you need to be, of course, friendly and non-threatening, assure confidentiality. Of course, if the person's intoxicated or in a delirium state, it won't be valid. And in my opinion, it's important to gain the caregiver's input if the person shows some impairment. Okay, quickly, I want to say to you, you have to introduce it nice and carefully. Now I'm going to ask you some questions about your use of alcoholic beverages in the past year. Why? Because alcohol can affect your health and interfere with your medication. That's why we're doing this, and your information will be confidential. Okay, so there's advantages and disadvantages to how you administer it. You can look at that. And there's the scoring. It's very clear when you add up the points. There's your scoring. And so you can look at that on your slide when you're doing this. And I want to quickly just go over maybe one of these 3 examples. I'll do the third. Well, we'll do the first one. The 75-year-old gentleman who was a widower. He acknowledged alcohol abuse with his primary care doc, and he's referred for neuropsychological testing to me because of his memory loss. So he came out as having MCI, mild cognitive impairment, not into the dementia zone. And I said to him, given your acknowledgement of your alcohol use, alcohol is a risk factor with dementia. And you can continue drinking like this, or you may be able to improve your memory or at least slow down the rate of developing more memory problems if you slow down or stop. and I asked him if he wanted to be referred. No, he wanted no help, nothing, and his lady friend, his girlfriend was there listening to it. Anyway, so I thought, well, I did my job, what else can I do? Anyway, long story short, 3 years later, his niece meets me because she works at a medical facility and said, I don't know what you did with my uncle, but a minor miracle, and he has stopped drinking. So sometimes one-time intervention does help. And I'll stop with that.
Thank you for your presentation, Dr. Hartmanstein. Valuable information. We did have a question from a participant, but I think you may have addressed it, asking if you'd recently seen the study cited on NBC News, Nightly News, that wine consumption helps to prevent colon cancer for men 2 glasses per day and women 1 glass per day.
Well, again, there are many studies that suggest that the lighter drinking does correlate with improved health. So, again, but it's light. It's not, 3 glasses a day kind of thing. So, yeah, there may be some health benefits. If you read stuff about the blue zones, places on the planet where people live the longest, you see that many of I think almost all those places in blue zones, people drink. But again, it's the quantity.
At this time, I'd like to turn it over to our host to wrap up our session.
Thank you, Dr. Stein, for such an excellent presentation, and thank you all for participating. Our next webinar will be held on June 15th, where Dr. Hartmanstein will discuss treating the caregivers of older adults. Remember, if we can be of assistance to you, please reach out. Enjoy the rest of your day.
Thank you, and this concludes our event for today.